Welcome to Better Than Ever Live, wherever you're watching, wherever you're listening. I hope you're making today your masterpiece. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injuries, or medical conditions. I hope you're having a great start to your week this Tuesday early afternoon here, or early morning, depending on where you're watching it. My week has not been very good. It's been almost rotten, I would say. But you know what's going to make it better? This show. Hearing comments and questions, whatever, from any of you will make me, hopefully, better than ever. And if that happens, you guys will make my week. So I'd love to hear your thoughts if you're watching this on YouTube, Facebook, or LinkedIn Live. Leave your name, where you are. Feel free to comment. If you're listening to this on podcast and you want to watch live, follow me on YouTube, on Facebook, or on LinkedIn. And those of you that do watch live but are going to miss shows, definitely subscribe to the podcast version, Better Than Ever Live, wherever you get your podcasts. As always, this is not medical advice. This is meant for general information and educational purposes only. I am not your doctor. I'd love to be your doctor. You're welcome to come to Charleston, South Carolina, or see me in Charlotte as well. I would greatly enjoy that, but this is not about that. This is meant to give you information to help you live better, feel better, exercise better, sleep better, age less. I was going to say age better, but I don't know exactly what that means. This is meant for general information and educational purposes only. Couple little things I want to get to. So this week, I'm back by popular demand. I'm doing Ask Dr. Geier Live on our Friday show. So an added Friday show where I'm going to answer your questions about health and wellness, information, studies, that kind of thing. Or if you have any sports medicine questions, bone and joint injury questions, definitely share that as well. Phil, very excited you coming to us from Germany. Thanks so much for that. D makes me laugh. It's really good. I'm just dealing with a bunch of people that I really just don't want to deal with. It's all good. And I am here with all of you, which makes me much, much happier. But live show on Friday, answering any questions. No set topics. Just going to be whatever you want to talk about, injury-wise, health and question-wise. Or I'm going to spend a few minutes talking about sports that are coming up that weekend. My college team, Wake Forest, has a big game on Saturday. Maybe I'll talk about that for 15 minutes. Next week, it is a short week work-wise here, at least in the United States. It's our Thanksgiving week. There will be no show on Friday. There will be the normal, or on Thursday. There will be the normal show on Tuesday. Maybe, depending on if my week gets better or anything else, I might do shows Wednesday and or Friday next week. We will see. I don't want to commit to that just yet because I am looking forward to some time off, but I just might do that. All right, I want to start with something that is serious, but it is worth talking about. You might have heard of this before. You may never have heard of this before. I was talking to somebody a few days ago when I read this article, and she had not heard about it, but this is a real thing. This one story I'm about to tell you happens, and it's not as uncommon as you would think. And I got this, of all places, from People magazine. But before you laugh at me, I don't read People magazine necessarily for celebrity gossip. It is a fantastic place to come up with ideas to pitch the media to be on TV, because if a celebrity has some kind of health condition, you can bet that all sorts of people would be interested in that, and then maybe they learn about that health condition because A-Rod or J-Lo or Madonna or whoever might have that condition. So it actually works really well in the media. Well, I read about a 23-year-old girl who nearly died after a spin class. Young woman in Massachusetts, 23 years old, named Kaylin Franco, was admitted to the hospital and had a life-threatening and certainly leg-threatening condition after doing a 45-minute spin class. And this wasn't some overweight, sedentary, never exercised a day in her life person. She played high school soccer and softball, played sports in college. Friend tells her, hey, you should try the spin class. She goes, she pushes herself pretty hard. Afterwards, she felt kind of weak, knees kind of gave out, that kind of thing, but she got through it, just thought she was sore. The next day, her legs were swollen and really sore. And as the day went on, she had more and more trouble bending her legs, more and more trouble walking. Finally, the big tip-off something was wrong is that her urine turned dark brown. So she went to the hospital and found out she had rhabdomyolysis. And we're going to talk a little quickly about what that is in a second, but I want to get to how that went. So she goes to the hospital. They do blood tests for a compound in her blood called creatine kinase. It's a muscle breakdown product. Where your normal creatine is somewhere between 33 and about 200, hers was 259,000, which is very, very dangerous. So they put her on an IV to try to get rid of all that IV fluids, and she developed compartment syndrome in her leg, and I'll talk about what that is in a second. They had to rush her to surgery really quickly to open up her leg, basically to let the pressure go down, and they basically saved her leg and saved her life. Now she's going to have these big scars on her legs, maybe have a fair amount of muscle weakness going forward, but at least she lived. All right, let me talk about what those two conditions are, and then I'm going to talk about the take-home point here. And I hate starting with something so negative, but this is worth knowing about. Everybody that I can tell that watches this show, that listens to this show, you love to exercise. You love to, stay in shape, that kind of thing. This is a real phenomenon, and it's not just spin classes. I'm going to talk about when people get this. Rhabdomyolysis is a medical condition where you work out really hard and the muscle breaks down. And when it breaks down, it dumps its internal components, namely creatine kinase, into the blood. Small amounts, not a big deal. Big amounts, it shuts down your kidneys and can be life-threatening. It's almost always something you'll be in the hospital for, and it can kill you. Compartment syndrome is a condition, it's usually of the leg. The muscles of your leg are separated into compartments by what's called fascia. It's like a thick envelope. It gives a little bit, but doesn't give that much. So when the muscles swell, you have a little bit of room for that. But if they swell a lot, those fascial layers basically become rigid barriers and there's nowhere for that muscle to go. So what gives are the blood vessels and the nerves that are running through those compartments as well. So you get very quick numbness and tingling, you get loss of blood flow to your legs. It's an emergency. And it typically doesn't happen in this scenario the next day. Where you're typically going to see this is if you break your leg, have a tibia fracture. All the blood leaks out of your tibia, it swells those muscle compartments, and you have to get to surgery really quickly to release those and then to stabilize the tibia. It can also occur in a milder form in what's called chronic exertional compartment syndrome, which is typically runners that those fascial compartments get tight, the muscle swells, but it's over sort of a longer period of time. It's not as severe. You stop running when those muscles, those calves get tight, that swelling goes down, and it just becomes, over time becomes something that's just really aggravating. You can't run as well as you want because your legs feel like they're balloons and it's really painful. That often needs surgery as well, but that's not a surgical emergency. That's something you can do when you just can't get over this. Physical therapy doesn't typically work. People have tried Botox to try to treat that condition. That's probably not the world's best answer either. That's usually a surgery. But in a traumatic setting, either after you break your leg, it can happen in the forearm too if you break your forearm bones, but if it happens after rhabdomyolysis and these acute workouts, surgical emergency. You have to go to surgery really quickly, or you could have your leg amputated. So this got a lot of attention because it was a spin class, and it's been reported in spin classes as well. But this very same phenomenon tends to happen in settings, and this is why I care in my world of sports medicine, in settings where football teams especially, but it's been described in a swim team. I think it was at the University of South Carolina, but it's typically football teams that are doing intense weightlifting exercises. It was reported a few years ago at the University of Oregon, and I think a few years before that at the University of Iowa with their football teams. And at least in one of the scenarios, they were coming off the Christmas break, getting back into the weight room. Another one was in the off season as well. And the coaches drove these kids to really push hard, not let them quit. That tends to be the underlying factor. Very, very intense muscle workouts, usually pushed by somebody else, by a coach. Spin class, you have an instructor. Usually people aren't going to push themselves that hard to where their muscles are swollen and exquisitely painful. They'll stop before it gets to that point. But in settings where you don't want to quit, you don't want to give up, pleasing somebody else or whatever, this is a risk. This was reported somewhat cynically back in the day. I don't know if you remember early in the days of CrossFit, they had an unofficial mascot named Uncle Rhabdo, sort of making fun of this condition. Now, I don't know how legit that was, if that was officially from CrossFit or sort of a joke that CrossFit, people did. You don't see it much anymore, but if you do an online search, I promise you'll find Uncle Rhabdo. If you search Uncle Rhabdo and CrossFit, you'll see all about it. This isn't a joke, though. This is a very serious condition that can kill you. So if after a hard workout, intense muscle pain, and you'll see it not just in the legs, you can see it in the triceps with really aggressive weightlifting exercises. That's another closed compartment that just doesn't have that much room to swell. Significant muscle pain, if you notice dark urine, significant muscle pain and swelling, definitely go to the hospital, go to the emergency room and get that checked out. So this sounds awful. It sounds like it'll turn out okay for her, but I just wanted to share it because it is something worth knowing. Okay, let's get to a little bit more good news stuff. Let's talk about strokes, right? Yeah, that's good news. 5th leading cause of death in this country, strokes, where the blood vessels that lead to your brain, you get a clot, lack of blood flow to the brain, you get a stroke. 5th leading cause of death, but it's also a huge cause of physical disability later in life, lasting brain damage. The good news is strokes, like heart disease, are largely preventable. There's studies that show that if you lead an overall healthy lifestyle, you can cut your risk of stroke by 80%. Now, what is a healthy lifestyle? It's all the things we talk about on here. Healthy diet, physical exercise, not smoking, moderate alcohol consumption, not tons of alcohol, and keeping your weight at an optimal level. The problem is only 22% of the American public follows the recommended dietary guidelines from the American Heart Association, which would lead to preventing stroke. And one of the things that's been focused on as far as the healthy diet has been the role of fats in your diet. Now, I will tell you that this comes under some controversy. The ketogenic diet people will tell you that the American Heart Association is completely wrong on this, that saturated fats in your diet aren't a problem. If anything, they're good. So there is debate, and there's starting to be some evolution in the thinking here. Having said that, it might not necessarily be the fat, it may be the types of fat in your diet. So a new study out of Harvard found that higher intake of vegetable fats and polyunsaturated fats actually lowers your stroke risk. On the other hand, higher consumption of animal fats, non-dairy animal fats, red meat in particular, increases your stroke risk. So it may not be how much fat in general, it may just be where that fat comes from. In fact, in their study, saturated fats in general did not lead to an increased risk of stroke. So we need a lot more research on this to see if there really is a benefit. Now, as far as cooking goes, when I say vegetable oil, the cooking vegetable oils have been shown in all sorts of ways to be really, really bad for you. But, the Mediterranean diet types of unsaturated fats from, fish and those types of things, fats from certain types of vegetables like coconut oil. I don't know if that's really a vegetable, but that's thought to be very helpful, maybe more so than the red meat saturated fat. There's a lot to know here. I don't know that fat in general is the issue with stroke, especially if you control all those other risk factors, but that's something we're going to have to watch for. All right, on either our last show or 2 shows ago, I talked about the number one drink that increases your risk of aging. And people were surprised to hear, according to the study that I read, that it was soft drinks, sodas, pops, whatever you want to call them. New study shows that, and it was published in Health Economics, shows that sugar-filled drinks, sugary drinks, are really bad for kids, especially young kids, but not so much in terms of weight and that kind of thing. That's probably true too, but it impacts their behavior and it impacts their math scores, their achievement in math class. What they found, these researchers, 462 kids, and they was split into 2 groups. One group either got 1 sugar-filled drink per day. The other group got drinks with artificial sweeteners. 1 sugary drink per day, on the boys at least, had an initial relaxing effect, and then all of a sudden they got more restless, whereas girls didn't seem to have that much effect on their behavior, but clearly not so good for boys. Those of you with parents out there may know what we're talking about. Consuming 1 sugary drink a day also had a negative effect on math scores and math achievement scores. Again, for boys, not girls. Now, I don't really know why the girls don't seem to be affected. May just need more people in the study to really see an effect, replicate this study, who knows. But another reason maybe to try water, try things with less sugar, maybe fruit juices that are fruit and not just sugar with a little bit of fruit flavoring. Those types of things might be worth looking into. All right, something else that affects kids, but not math scores. Let's talk about reading ability. Their reading ability is thought to be a good judge, especially in young kids. How well they read is thought to be a very strong predictor of their later academic success and a lot of positive life outcomes later on. Well, a new study in the British Journal of Educational Psychology looked at over 300 kids between 4 and 14 years old. The parents completed questionnaires about their kids' sleep. The children then did these reading efficiency tests, and guess what? The kids who didn't sleep well, they were either more tired during the day, they fell asleep quicker, which shows that they're tired, tended to perform much worse on reading tasks than the kids who slept well. So, if your kids are struggling to read, which again is very important, you might look at their sleep issues, and vice versa. If they struggle with sleep, maybe the teachers can put them through reading aptitude tests, fix the sleep, potentially improve their reading, hopefully improve them later in life. And I tell you, I'm not good at many things in life, but I do feel like I'm a pretty good reader, so maybe that's why I've at least gotten to this point. All right, something else that can affect the development of kids, and we've talked a lot about it on this show, and that is screen time. And I know we talked about a couple of weeks ago a study that shows maybe screen time's not so bad. I've talked about studies that show maybe screen time is so bad. But there's a new study out of the University of Michigan. It's kind of interesting, actually. There may be a way to counteract the effects of screen time. And in this case, television is what we're talking about. And it's very, very simple. Specifically, talking to the kids while they're watching TV. What they did, they took 1,500 preschoolers, this was published in PLOS ONE, and compared putting a child in front of a TV, passively watching a show, or having the kid passively watching a show, the parents in the room but just on their phone, or kids passively watching a show on TV and the mom or dad are asking them questions about it and pointing things out on the show. And what they found is that if the parents encouraged their watching the show but asking questions, it piqued their curiosity. It boosted their thinking, their learning, their explanation, all of which boosted curiosity. You think, oh, well, what does that matter? Curiosity has been linked to a number of different metrics involving childhood development, later academic success. You want kids that are naturally curious. Now, if they're not watching TV, maybe they're reading, maybe they're outside playing and they're exploring, which boosts their curiosity naturally. TV, in theory, would shut that down. You're just passively staring at a screen. So if you're there with them, instead of just letting them passively watch that screen, talk to them about it. If you've got your 5-6-year-olds or a little bit older watching Grey's Anatomy, talk to them about the medical conditions you're seeing or what being a doctor or a nurse is like, or just talk to them about what you're seeing on the show. Ask them questions. You might see some positive benefit. But I do think it's funny, parents sitting there in the room talking on their phones, just letting the kids watch TV, not at all helpful. Big shocker there. All right, last thing I think I've got about kids, and this isn't just kids, this is for young adults as well, and we're getting back to stroke risk. One of the biggest risk factors for having a stroke is cigarette smoking. But it turns out that vaping is actually worse for your stroke risk than cigarette smoking. In fact, if you vape, you're likely to have a stroke 10 years younger than if you smoke cigarettes. This was a study done out of Mount Sinai in New York. What they found, couple things. E-cigarette users, 15% higher risk of stroke and at a younger age than cigarette smokers. Cigarette smokers, on average, if they have a stroke, it's at age 59. Vaping, it's at age 48. So the question is why? Well, what they found, and I'll be honest, I've never been interested in smoking of any kind, including e-cigarettes and vaping, but the liquid in e-cigarettes that's superheated to form a vapor has all kinds of harmful chemicals. Formaldehyde, all these benzene, toluene, xylenes, polycystic aromatic hydrocarbons. I don't even know what that is, but that can't be good. All of those are bad for you. They increase inflammation in the brain. They weaken the blood-brain barrier. They increase your heart rate, increase your blood vessel, disrupt blood vessel function, and promote clotting in the arteries that lead up to your brain. All of which increase your risk for a stroke. So why does this matter? If you're a smoker and you're thinking, well, I'll switch to e-cigarettes to be healthier, in some ways it may not be healthier, may actually increase your risk of a stroke and a stroke at an earlier age. Plus, studies have shown that people who vape are actually more likely to relapse to smoking cigarettes. So something to think about both if you smoke or use e-cigarettes, but better than that, if you don't do any of that and are thinking about doing it, or if you have kids that are exposed to people that do this, really try to keep them off of it. All right, let's talk about social support and social isolation. This is really important. Let's first start by talking about pregnant women. I know that's sort of a narrow niche, but those of you females out there, maybe you become pregnant someday, maybe you don't, but this is important to know. And why this matters, mental health in pregnant women can be a struggle. 1 in 4 pregnant women suffer depression. 1 in 5 pregnant women suffer anxiety. Turns out that pregnant women who lack social support significantly higher risk of depression and anxiety. So why would a pregnant woman not have social support? Well, maybe she's somewhere away from her family, or because of geography or work, she's not around a lot of people. Maybe she's having a baby alone, doesn't have a partner, any number of reasons, but we want to identify this. Because here's the thing, pregnancy or depression or anxiety during pregnancy have a lot of risks. 1, higher risk of complications during the pregnancy, more likely to have postpartum depression, more likely to have problems bonding with the baby at an early age. So we want to identify these as quickly as possible. But pregnant women with no social support or low social support, 7 times more likely to develop anxiety than pregnant women that have a social network, 4 times more likely to develop depression. So this is something as OBGYNs worth sort of screening for, paying attention for, but also if you're pregnant, to pay attention to this. Talk to your doctor about this. Try to find a network of people that you can talk to. Again, I'm not huge on social media, but even that would be better, I would argue, than nothing. But having lunches with people, just people you can call and discuss things with, very, very important. So what is it about social isolation that makes it so harmful? And it's not just pregnant women, it's harmful for everybody. Social isolation, loneliness, or a combination of the two, you have a 29% higher risk of developing heart disease, 32% greater risk of having a stroke, just by not being around people on a regular basis. Social isolation increases your risk for cardiovascular disease in levels comparable to some really bad things. Smoking 15 cigarettes a day, that's no worse than social isolation. High blood pressure, or just overall being sedentary. So there's a new study published in the Journal of the American Geriatric Society that looks at why social isolation is so bad for your health. And it turns out that it actually creates an inflammatory reaction and a chronic inflammatory state. We've talked about that a little bit on this show before. Chronic inflammation, your stress hormone levels, which are fine for an acute event, you have to run away from a dog or something like that, but then the hormones go back down, hormones like cortisol. In this state, they're chronically elevated, and that causes the white blood cells in your body and the inflammatory cells to attack damaged tissue, or attack healthy tissues, damage them, and that's what leads to aging. Well, specifically, there are 2 markers for inflammation that show that, hey, this is a problem. C-reactive protein and interleukin-6. And this study found that people who were isolated significantly higher levels of both inflammatory markers, C-reactive protein and interleukin-6. So this is, it's one of those things that's probably a better study for the doctors, the primary care doctors that take care of people, especially older people, recognizing social isolation, and counseling on that. But something to think about, trying to keep a network of friends, because that can be very bad for your health, especially as you get older. All right, so what's one of the good things we can do for our health? And that is exercise. So we talked about postpartum depression, postpartum anxiety. Whether or not it's postpartum or not, exercise can be a fantastic treatment for anxiety. A study published in the Journal of Affective Disorders looked at almost 300 people with anxiety syndrome, including people with chronic anxiety up to 10 years of having that. And what they found, 12 weeks of exercise significantly reduced their anxiety symptoms. But it wasn't just any exercise. The more intense your exercise, the better it treated your anxiety, the better it lowered your anxiety symptoms. Typically, what we do with anxiety is either cognitive behavioral therapy or medications, drugs. But there may be something better, and that is running or lifting weights or spin classes, or any number of types of exercise can help lower your anxiety. All right, one of the and I talked about this in a different way a couple weeks ago. One of the things that really irritates me about the orthopedic surgery world is this idea that arthritis is a wear and tear problem. The analogy we always use, and I apologize, some of you have heard my rant about this before, but orthopedic surgeons compare the cartilage on the end of the knee, the end of the hip, to tread on a tire. And wear and tear exercise over time can thin that tread. You end up with basically a bald tire, essentially bone on bone, and you need a hip replacement. You need a knee replacement. And I talked a couple weeks ago or a week ago, whenever that was, about how there aren't really any studies that prove that exercise causes arthritis. And in fact, exercise may help reverse that. But new study from the Oklahoma Medical Research Foundation, it was published in Osteoarthritis and Cartilage, says that exercise might help your arthritic joint even if you don't lose any weight from it. And that's one of the arguments is that, these people are overweight, they have this arthritic knee, and they say they can't exercise. And the orthopedic surgeon says, oh, we'll just replace it. But this study really gets at hey, this isn't a wear and tear problem. Listen to the lead author of this study says what I've been saying for a while now. He says, quote, traditionally, we've thought of osteoarthritis primarily being the result of a joint wearing down due to age and other factors similar to the tread on your tires. Today we know that biological factors are critical to this process. That is absolutely right. Yes, there may be a little component of wear and tear and a little component of genetics, but it's so much related to chronic inflammation and having high levels of inflammatory cytokines and degradative enzymes in your knee, interleukin-1 beta, interleukin-6, tumor necrosis factor alpha, that damage the cartilage, break it down, damage the bone, and then you end up with a bone-on-bone problem. It's a disease that we can prevent or treat. And so this study shows more examples of that. What they did is they wanted to see how diet and exercise affected the knee joints of mice. So they examined the joint fluid, the synovial fluid. What they did is they put these mice in either high-fat diets or low-fat diets. When the high-fat diet mice got overweight, obese, then they split them into two groups and gave one half of those obese, high-fat mice an exercise wheel in their little pens, and one group, none. And then they drew the synovial fluid off, sent it to a lab to look for these inflammatory metabolites in the synovial fluid. The obese mice that were sedentary, high levels of all of that. The mice that were still obese but had an exercise wheel, didn't. They basically had synovial fluid like lean, healthy mice, even the ones that didn't lose weight. So if you've got arthritis, you still want to get out and exercise. You might have to, tweak what you do. Maybe you don't run 7 days a week. Maybe you run a few days a week and swim or cycle or lift weights. But exercise is good for your knee. Don't think of it as wear and tear. Think of it as an inflammatory process that breaks down cartilage, and exercise is one of those things that can block that. Exercise stimulates your muscles release what's called myokines. Those myokines have a protective effect on cartilage. So if somebody tells you, your doctor, your orthopedic surgeon, whoever, that you've got arthritis, you need to stop exercising, find somebody else and get back there and keep exercising. All right, what if you like to exercise, but you're really busy? I think I may be completely wrong here. Jedi Master Jan. Yeah, this is coming full circle. I assume you're talking about the osteoarthritis. Awesome how views are changing on this. This is going to be, over the next 5 to 10 years, the game changer. I know knee replacements, hip replacements are skyrocketing, and hundreds and hundreds of thousands are projected over the next few years, at least here in the United States. But if we can get people in their 30s and 40s, exercise and do all the healthy lifestyle, keep the inflammation down, and there's peptides and other medications too that can block those degradative enzymes and inflammatory cytokines, we can prevent a huge number of these joint replacements, which I would argue is a good thing. The joint replacement surgeons and the hospitals may disagree with you, but that's a good thing. All right, so back to, if you're busy, how can you get that exercise? Maybe you're you have kids, you have a busy job, you work with people outside of work, whether it's a charity or you do volunteer work, or you're just running the kids all around, you coach a dance team, whatever it is, you're really busy, you don't have time to exercise. How can you get the benefits of the exercise around a busy schedule? There's a new study out of McMaster University in Canada, and that doesn't sound famous, but they're one of the world leaders in exercise science, actually. One of their professors is a guy named Martin Gabala, who wrote, you've heard me talk about it on this show before. If you haven't read it, it's worth reading. It's a short book. It's called The 1 Minute Workout, and it really put HIIT training, HIIT workouts, high intensity interval training on the map. Well, they have developed something that they call, I don't know that they really developed it, but they've nicknamed it, and that is what's called an exercise snack. And no, it's not food, it's short bursts of movement to basically get all the benefits of exercise, but without the 30 or 60 minutes of exercise. And we're talking about 15 to 30 seconds of quick physical activity. Some of the things they talk about running up the stairs or just climbing stairs quickly. They talk about short session of jumping jacks. If you have access to a stationary bike, 15 to 30 seconds on a stationary bike. They don't talk about this, but it could be things like a kettlebell in your office or any number of things. Short bursts of just physical activity, hard effort. 3 times a day, 15 to 30 seconds. That's all you need to do. And not only does that break up the time you're sitting, but it improves your overall fitness. Now, they speculate that this is probably more important for people that are sedentary and not exercising at all. If you're otherwise exercised, maybe it doesn't add that much more. But if you're really busy on a particular day, and that all happens, I've had days where I was taking an early morning flight out, and I've been at the gym as early as 3 in the morning before, which was probably awful for me. Maybe finding time to do an exercise snack, 3 or 4 sessions, 15 to 30 seconds each, quick physical activity, I wouldn't have had to get to the gym at 3 in the morning. So that may be something you think about on a day that you've got meetings all day, you've got class if you're a student, you got tests coming up, whatever it is. Exercise snacks. Keep that one in the back of your mind. So exercise snacks, the way Dr. Gabala and this group talk about it, are a short form of what we call high-intensity interval training. And that's basically the claims of HIIT training is that you can get all the benefits of physical activity in really short workouts. You're going really hard for 20 seconds or 30 seconds or a minute or a few minutes, and then long periods of rest. And in a 15 to 20 minute workout, you can get all the benefits of, let's say, 60 minutes of steady state cardio. Well, 2 new studies question whether HIIT training is any better than steady state cardio. One in the Journal of Strength and Conditioning Research found that in terms of fat metabolism, oxygen uptake, heart rate, the HIIT training was really no better than continuous training. Another study out of the University of Texas looked at the mental health of people who did HIIT sessions or continuous cardio, and they made sure that overall the average energy expenditure and average intensity were the same in either group. It was just how they got that exercise. There was no difference in mood, no difference in the perceived exertion, basically how hard you felt like you were working, and no difference in enjoyment. Now, what I'm going to tell you is I'm skeptical. If you hate high-intensity interval training, you just hate those all-out 20-second, 30-second, whatever they are, then maybe do steady-state cardio. But if you're short on time, if you're busy, I would argue steady-state cardio. You need to read 1 Minute Workout, but the HIIT training, I would argue, is probably better. Here's the thing. If you go hard for steady state cardio, you're really pushing yourself, you're probably going to get a benefit. But if you go to the gym, if you go to a Planet Fitness or a Gold's Gym or a lot of these places and you see people on the elliptical or on the stationary bike and they're just sort of barely doing it, they're just sort of going through the motions, probably not going to do all that much for you. Here's the thing though. I've said this before and I'm going to say it for our last study. The key is to find something that you like doing. The best type of exercise is the type that you're actually going to do, whether that's steady state cardio, whether that's HIIT training, whether that's weights or some combination of all of those. But some people hate exercise with a passion. A new study, I love this. We're going to end on this. A new study shows, and it was done by OnePoll, did the survey. It was a lifestyle and fitness coaching app called Freeletics that commissioned them. They took 2,000 people who exercise on a regular basis, not just casual, they were frequent exercisers. Half of them find no joy in their daily exercise, which stuns me. If you don't like it, why are you doing it? But they go through the motions and do it. Half of them say they don't work out as much as they'd like because they just don't like it. But what's funny about this story is how much they hate it and what they would be willing to do or give up to never have to do it again. And I'm not talking about a peptide like Mod-SC that's exercise in a bottle that you just basically have an injection and it does the cyclic AMP and all the pathways to mimic exercise. And yes, that's a real thing. That's out now and it's going to be a big thing over the next few years. Maybe we'll talk about that here soon. But no, we're talking about I hate exercise so much, I don't ever want to exercise again. Get this, 25% of people would cancel Netflix for a year to not exercise again. Another 25% would text an ex of theirs, ex-girlfriend, ex-boyfriend, ex-husband or wife. Almost 30% would reach out and reconnect with their high school bully to never exercise again. A third would stay with their in-laws for a long weekend. That is hilarious. Yikes. And just over the third, the highest one, 34%, would hand wash all of their dishes for the rest of their life to never have to exercise again. Now, they kind of went into more detail about why there was some of these trouble. And, 38% say they do the same routines over and over again. 54% completely check out during their workouts because they're bored. 18% say their body's on autopilot during their routines. It gets back to what I was just saying before this. The best type of exercise is the type you'll actually do. So find out whatever that is. If exercise isn't fun for you, find something else. Go do stand-up paddleboarding. Go play a sport. Go, anything. I ran for years and then I just decided, you know what, I don't like this, and I stopped doing it, but kept with the lifting weights and some other things I do. What I do is probably not going to be good for you or for the next person. You want to find something that you enjoy, because if you enjoy it, you are more likely to stick with it. You're more likely to push yourself harder. And again, we talked about the better the intensity. In this case, it was lower anxiety symptoms. But the harder you push yourself, it's going to be good for all kinds of things. It's going to be good for your fat metabolism. It's going to be good for your VO2 max and your cardiorespiratory fitness and all kinds of things. It is going to be better for you. So, would you cancel Netflix for a year? Would you hand wash dishes for the rest of your life? I had to do that for about a week and a half a couple months ago because my dishwasher broke. That was miserable. I can't imagine doing that for the rest of my life. I know, first world problems, right? All right, that is all I've got for you. Chanu and Phil, I apologize for not answering your medical questions, but like I said, if you join us Friday, I am doing an Ask Dr. Geier Live, same time, noon Eastern time, and I am happy to do that. I have got to head. I've got patients that I am seeing starting in 15 minutes. I got to get over to my office. Thank you so much for watching. If you want to watch this live, ask your questions, comment on what we're doing. There are the social media. drdavidgeier.com is the website, and then youtube.com/Dr. David Geier. Facebook.com/Dr. David Geier, Twitter.com/Dr. David Geier, Instagram, all of it is at DRDAVIDGEIER. Really excited to be here with you guys, and I will see you right back here on Thursday, noon Eastern. Have a great